Official. Further restrictions are coming to Toronto to fight COVID-19 as the city sees a resurgence in cases. Toronto City Council voting in favor of a plan that will mainly affect restaurants and bars in the city, an industry already struggling to keep the lights on and keep people employed, but officials calling it a necessary step to protect the people of Toronto. As Toronto grapples with a surge in COVID-19 cases, the city's top doctor has proposed killing the concept of 10-person social circles, calling them ineffective as schools reopen and more people head back to work.
The bubble is not a useful concept anymore, and that what we're trying to do is limit contacts with those outside of your household as much as possible.
It is one of several recommendations presented to City Council this afternoon to curb the spread of the virus before it's too late. Further restrictions include cutting the number of people allowed in restaurants from 100 to 75, requiring bars and restaurants to log contact information for every customer, cutting the maximum number at a table from 10 people to 6, ordering bars and restaurants to play music no louder than normal conversation to prevent spreading droplets, and urging the province to mandate masks in workplaces when physical distancing isn't possible. The concern, how this might impact the already struggling food service industry, prompting the mayor to bring forward further supports for restaurants, for instance, providing winter patio options and requesting financial support from the federal government.
I am committed to doing everything possible as a city government to help restaurants and other businesses that are hard hit.
Meantime, council's tackling another major crisis in the city that has been exacerbated during the pandemic: housing and the city's overburdened shelter system.
There are people who have made shelter their home, and that can't be.
All those in favor of the item as amended?
Council has voted in favor of a plan to move 3,000 shelter residents into supportive housing, which is estimated to save the city $15 million a month.
If you didn't feel that moral case before, there's a financial case. Housing solutions are actually cheaper than shelters.
In Toronto, the average cost of operating a supportive housing unit is $24,000 annually, while the average cost of operating a single shelter bed is $40,000, nearly doubling to $80,000 during the pandemic.
I'd call most of what we ask for, in fact, all of it, a no-brainer in business. You just proceed to do it because it makes so much sense, it's so morally right, and it is so necessary for us at this point in time.
But the mayor acknowledges the city can't do this on its own. While the plan saves money overall, it requires upfront investment from the federal and provincial governments, more than $725 million in 2020 alone. More than 30 sites have been identified so far for possible redevelopment into permanent or transitional housing to move longer-term residents out of the emergency shelter system. The plan would be implemented over the next 2 years. For City News, I'm Yazdani.